one of the procedures that we routinely do is a spinal anesthetic, which is where we have the patient sit on the side of the bed. They already have their monitors on and have some extra oxygen through the nasal cannula. And we work in some sedation medicine through the IVs to take away any anxiety they might have. And I clean off their back sterilely, numb up the skin, even with their hip bones, insert a tiny needle, inject a third of a teaspoon of medicine, and take away the needle. And within a couple of minutes, from here down is numb. It allows the surgeon to perform surgery on their knee or their hip without them feeling it, and they can continue to breathe on their own without us having to put in a breathing tube and connecting it to a ventilator and delivering anesthetic gases that unfortunately can cause nausea or vomiting about 30% of the time. So that's one of the primary choices that we use. General anesthesia is another option, and that's an option that might be employed for a particular patient with a set of medical problems that calls for general anesthesia, or who, because of medicines that he's taken, it would better get a general anesthetic than a spinal. There are two other procedures that we typically do in the procedure room, even before we do the spinal, and one is a sciatic nerve block, and the other is a lumbar plexus nerve block. Those two nerve blocks block the four nerves that conduct pain from the hip and from the knee. So in the case of knee operations and hip operations, we do those two nerve blocks, and the patient has improved postoperative pain relief for a number of hours after the operation. This, combined with getting medicine by mouth on the ward and medicine through an IV, if necessary, by a patient-controlled device, a PCA, is a multimodal approach to providing anesthesia. And oftentimes the surgeon also implants a device underneath the incision that infuses local anesthetic. An OnCue device, it's a ball about the size of an orange that slowly contracts, and about a half a teaspoon of medicine an hour of local anesthetic is infused into the wound to decrease pain sensation from the surgical site. And oftentimes Toradol is included in that, a non-steroidal medicine. So it's a multimodal approach of using nerve blocks that I place, the OnCue device that the surgeon places, medicine by mouth that the nurses on the ward will provide to the patient, and if necessary, a push-button device of IV medicine that provides pain relief.